Smokers are more likely to be admitted to hospital with COVID-19. That's according to a study published in the peer-reviewed journal Thorax. The research study found current smokers were 80% more likely to die from the disease than people who had never smoked. Let's discuss this with Waasila Jassat, who is a public health specialist from the National Institute for Communicable Diseases. Thank you for making time, Waasila. What do you make of the study, just the methodology and the data that was used?
Thank you for having me. I think there's been a lot of conflicting evidence in the last year and a half about the risks of smoking and COVID-19. So this was a large study from the United Kingdom. It used over 400,000 patients were eligible to be included, and they used multiple data sources, including the biobank and primary healthcare records for smoking status, and then COVID testing data and hospital admission and death certificates, and really were able to do analysis of the risks associated with smoking and COVID hospitalization and mortality. What they found that compared to those who never smoked, those who were current smokers had a higher risk of being hospitalized and of dying. And in fact, with a higher number of cigarette use, there was a higher risk of mortality. So if you smoked less than 10 a day, you had a 2 times higher risk of dying. And if you smoked 10 to 20 a day, you had a 5 times higher risk of dying. And if you smoked over 20 a day, you had a 6 times higher risk of dying in hospital.
Yeah, and I'm glad you mentioned that there has been conflicting evidence on this issue, because I was thinking, isn't there research on long COVID appearing to show smoking is protective against persistent symptoms 1 month after the COVID-19 hospitalization?
So let me take a step back and take you through some of the conflicting evidence. So very early on, there were some studies, particularly in the USA, China, and France, that showed that the prevalence of smokers amongst those who were developing COVID-19 was less than the population prevalence of smokers, and that smokers were underrepresented amongst those with COVID-19. And so this led people to adopt the term the smoker's paradox, wherein they thought that smokers were protected from COVID infection and severe disease. And in fact, that there's even, this term has been used for many years to describe what's an unexpected outcome of less mortality for patients with heart attacks and strokes. But I must say that some of these studies had limitations in the quality of the data. It's very difficult to determine smoking status. Patients may not say that they're smokers. They may not say that they were former smokers and they just stopped smoking yesterday. They don't say how many cigarettes they smoke and for how many years. And we don't have an objective, measure of smoking, which would be a blood test, and rather we rely on the self-reported status of smoking. So I think all of these limit our, some of those earlier studies. There are some plausible biological mechanisms where we believe that smoking might be protective. And so some of the studies say that the nicotine in the cigarette smoke could have an anti-inflammatory effect. It could inhibit cytokines. And we know that with COVID-19, patients are at risk of getting cytokine storm and this COVID pneumonia. And so this blunted immune response in smokers could, reduce their risk of having the cytokine storm. There are other things in cigarettes that could upregulate the cells that are used to enter, for the virus to enter the cell. And so in theory, there are some mechanisms that say, okay, smoking might be protective, but there are other mechanisms that we know that smoking could worsen your prognosis with COVID. Some cigarettes are sometimes shared, and if you're asymptomatic, you could share it with someone and it could pass on the virus. And we know that smoking is a strong risk factor for heart disease and lung disease, which are associated with worse COVID outcomes. And also smoking, it suppresses your immune system, and it disrupts your lining of your respiratory system. And so this could make you more liable to get worse disease. So I think all of these things show us that there are some possible interactions between smoking and COVID that could be harmful or could be protective. This study and a few other studies are showing us with more conclusive evidence, with bigger numbers of patients, that there are risks of COVID-19 with smoking to lead to higher rates of COVID-19 hospitalizations and deaths. You're quite right. We have been doing a long COVID study at the NICD where we follow up patients after discharge from hospital at 1 month, 3 months, 6 months, and 12 months to document how many have persistent symptoms or long COVID. And interestingly, we have found that those who are smokers have less likelihood of having persistent symptoms, and we're still trying to understand why that is, and our study may also be prone to some of the limitations I discussed earlier.
Yeah, so with all these conflicting evidence, for those that are watching us and thinking, should I be stopping to smoke or not, what's your advice?
Well, I mean, I think because we don't have conclusive evidence about the risk for COVID-19, but the indications of the good, strong studies are that it has a higher risk for COVID hospitalization and mortality. I think that, you know, it makes sense to stop smoking if you are a smoker. But, I mean, irrespective of the evidence around COVID-19, we have many, many decades of knowledge and evidence to show that smoking is detrimental to public health. And I think we should be very cautious citing articles and saying that smoking is protective against COVID-19, because even if by some chance it does have some protective effect, it's likely to outweigh the many, many proven adverse health effects of smoking.
All right, thanks for making time for us. Public health specialist Waasila Jassat speaking to us about this new research that found that smokers are more likely to be admitted to hospital with COVID-19.